Jaw and muscle sprain or strain, JAMSS. Did you know JAMSS can occur after a long dental procedure? What is JAMSS? JAMSS stands for jaw and muscle sprain or strain. All joints in our body move, and the amount of normal movement is governed by each particular joint structure. For example, the amount of movement available to a healthy ankle joint would be dramatically different from the amount of full movement available to a healthy jaw joint. Regardless, when any joint is injured, the range of motion decreases and the patient reports pain. Here is an illustration of a normal jaw opening cycle. The digastric and lateral pterygoid muscles are the openers and are activated. In the closing cycle, you can see the masseter, temporalis, and the medial pterygoid muscles activate. In a normal jaw closing cycle, the jaw opening muscles deactivate. During the normal opening cycle, the jaw opens to a person's voluntary range of motion. However, there are times when a joint may be moved beyond what is voluntarily possible, but does not always result in an injury. An example of this is when the dentist asks the patient to open wide. Keep in mind, the risk will vary from patient to patient depending on whether there is a prior history of jaw injury and the length of time that the jaw is held open. Here we see the dentist or assistant provide a gentle amount of external force, making the mouth more accessible. The handpiece or use of a bite block place the jaw joints at risk by mobilizing the jaw joint to an involuntary range of motion. The downward pressure stretches the joint beyond the maximum voluntary opening and can trigger muscle guarding. Extending joints beyond their normal range of motion can trigger the simultaneous activation of the opener and closing muscles. In this animation, even several hours after the procedure, the patient's musculature is still activated, protectively guarding the injured muscle. Hypertonicity shown in this video with lightning bolts can be identified through palpation. Over time, this muscle hyperactivity becomes a self-activating and self-perpetuating issue. Patients may present with jaw and muscle sprain or strain 24 to 48 hours after a procedure. The good news is that the vast majority of patients struggling with JAMSS symptoms fully recover within the first few weeks. And for the roughly 15 to 20% that seem to take longer to feel as if they are recovering, well, we have some answers on how to help. The Speed to Treat protocol is effective for quickly treating those patients that complain of JAMSS symptoms. And the SAFE protocol prepares your team on how to prevent JAMSS injuries in the first place. It is important that everyone on your team is trained on how to respond when a patient contacts your office with a jaw sprain or strain injury. JAMSS injuries are easy to address if you treat promptly with a temporary anterior deprogrammer like QuickSplint, which allows the jaw muscles to rest and heal during sleep. The best outcomes are achieved when the patient fully engages in effective self-care strategies at home. Encourage them to follow the HEALS protocol.